Dr. Dennis Locks has treated patients from around the world, including celebrities, professional athletes, and patients just wanting a better quality of life through regenerative medicine. And one of those athletes, Antonio Tarver, is here, along with a Morning Blend favorite, and Ian Beckles, both former athletes, both working with Dr. Locks. And I know that both of you all smile saying, this is the guy that is getting you back to feeling good. Welcome back, Dr. Locks. How have you been?
I've been great, thank you.
So when you're here, our conversations go from obviously education of stem cell therapy, which is very important, to movies, to fashion, to athletics. I mean, we really do cover it all, and that's how a lot of your relationships for the people you help form, right?
Relationships is a taboo subject, but correct.
Because we were saying Ian Beckles is a known patient of yours, which we always love hearing his story. But introduce your next guest, because this is the first time that Antonio has been with you. Well,
Derek sent me a text and said he has a friend, Antonio Tarver, and I was at one of his great fights in Tampa with Roy Jones, and I knew that he was in Rocky Balboa, and so we connected on that front because I'm a movie buff, and so we hit it off very well.
So you were even talking entertainment, but at the end of the day, you wouldn't have been able to be a part of the movie or feeling as good if it wasn't for Dr. Locks. Explain how you were feeling and why you decided to give stem cell therapy, especially with Dr. Locks, a chance.
Well, basically, I think I tried everything else under the sun. It had been a few years of just treating my ankle, which flared up on me one day. I was on the golf course, and it seemed like I just bumped a tree or something. And I went home, and I couldn't understand the pain I was in. And it was like weeks on weeks and then months on months, and this thing was not getting better. So it's just been treating with soaking it, icing it, everything. And I had some cortisone shots. I used to go to the doctor all the time in pain. And when, you know, my sport, boxing, you have to be on your feet all the time. You're bouncing, you're moving, you're jump roping, you're running. You know, you need your legs. And when I started struggling with that, my performance definitely kind of slid down a couple notches. So, and ever since then, it's just been about getting healthy, getting 100%, trying to get as close to 100% as possible. And it wasn't until, you know, I came to see Dr. Locks and his treatment, and we've been doing it now for about 6-7 months. And I can tell you, I sleep a lot better. I'm more active now. Even though I'm still, he don't want me to run, and I feel like that's the missing piece. But sometimes when you're dealing with your ankle and stuff, it's just, that pain is too much to bear. But you know, I've seen better days, and I think I'm recuperating and getting closer to that 100%, where then I can start doing some things that I miss doing and love to do as well.
And Ian, I mean, you've been open about some of the injuries that you had from being a part of the NFL for so long. And now that you're able to be away from the sports world and you've been able to see the benefits of stem cell therapy, what do you want people out there to know? Because I feel like there's some misconceptions, there's some myths. What message do you like to spread?
I mean, it's about being the best you. And sometimes people don't know what they're missing. Okay, and with myself, you know, you figure it's the wear and tear, and you're just going to break down as you get older. And don't concede, because you can't kind of turn back the clock a little bit with Dr. Locks and stem cell therapy. I got to the point where I was having problems bending my knees, and after having stem cell therapy, you know, I was working out a couple of college kids, and they were amazed at my knee bend at 50 years old. So I really attest that to what Dr. Locks did, and I wouldn't be able to do that without the stem cell therapy. So there's still people, and there's always a stigma from different things. I'm just telling you, for me, it's the best thing I've done for this body, and this body's been through a lot.
Well, and both of you guys, former athletes, but we don't want people out there who are watching to say, oh, I'm not a former athlete, Dr. Locks may not be for me. That is quite the contrary, right?
That's correct. I was an amateur boxer, so I understood what Antonio's needs and what goes into training, but not professional. But I have patients who just hurt, and as you get older, things hurt, and so we take care of a lot of people. But if you can understand the difficult patients and that what happens to an athlete, then understanding a patient who's 70 and just wants to get up and out of their house and go shopping or do something. That's very important to their lives. So we can help make a difference in a lot of people's lives.
Well, I love how you just said that you use understanding, and I know education, of course, is so important to you as well, along with your patients, and people get that individualized treatment with you. Well, Dr. Locks, we love when you're here. Please come back. Continue to bring guests. Guys, thank you so much. And if you're interested, if you want to know more about how Dr. Locks can help you, there's the website address and phone number on your screen. And as always, guys, we do appreciate your time.